Welcome to Clinical Capsules, your go-to podcast for quick, evidence-based insights from TRC Healthcare. This year, we're celebrating 40 years of keeping healthcare professionals ahead of critical medication updates and guidelines. Every second and fourth Tuesday, our expert editors from Pharmacist Letter, Prescriber Insights, and Pharmacy Technicians Letter will break down the most impactful clinical developments, giving you clear, actionable takeaways in just minutes. Today, you'll hear an excerpt from our October 2024 Pharmacy Essential Updates Continuing Education webinar series. In this segment, Assistant Editor and Pharmacist Rachel Cole examines the role of empiric vitamin D supplementation. Let's dive in.
Let's dig into the question, to D or not to D, and take a fresh look at vitamin D. We know there's been a lot of discussion about vitamin D over the years, and now we're getting more evidence about whether vitamin D supplements are needed for most patients. So, our article on this topic talks about recent guidelines from the Endocrine Society and that they may bring more clarity about the role of empiric vitamin D supplements in certain groups. Over the years, there's been a lot of interest in using vitamin D for a variety of health benefits, and many people have been interested in supplementation, including at high doses of vitamin D. But some new data may provide more specific direction regarding who would benefit the most from empiric vitamin D, and also additional guidance on screening. That's because recent randomized trials showed that vitamin D supplements don't benefit a variety of conditions, like heart disease, various types of cancer, or dementia. And I think this is surprising to many of us because low vitamin D levels have been associated with an increased risk for these issues in others, and there were years of promising observational data. But we haven't seen those results pan out in randomized controlled trials, which are better able to show cause and effect, rather than just an association or link. Plus, most evidence suggests vitamin D supplements don't reduce falls in older patients, and there's no good evidence that vitamin D supplements boost energy. So we've really been learning more about the role of vitamin D supplements in adults, and that there may not be as much benefit as we once thought, based on that earlier observational data. Now, this also ties in with the idea of screening for low vitamin D levels. I think this has also become more common over the years, but screening for vitamin D is often not necessary. In fact, a number of groups have come out to say that there's not enough evidence to recommend screening for vitamin D deficiency in most children and adults. So we want to advise saving vitamin D screening for certain groups of patients, such as patients with osteoporosis, or patients who are at risk of low vitamin D levels due to issues such as chronic kidney disease or malabsorption. For example, this can include patients with inflammatory bowel disease, such as Crohn's disease. But again, routine screening is not needed for most children and adults. Also, keep in mind, these new guidelines do not address individuals with underlying conditions that alter vitamin D physiology, or decrease absorption or activation, or increased renal losses. It also doesn't address those known to be at high risk of fractures. So let's now take a look at how much vitamin D most patients should usually get. Daily intake recommendations vary by organization. So in general, suggest getting 10 micrograms per day or 400 international units for children up to 18 years, 15 micrograms per day or 600 international units for adults up to age 70, and 20 to 25 micrograms per day or 800 to 1,000 international units for older patients. And those are the doses suggested in order to maintain bone health from both foods and supplements. Now, some guidelines have different recommendations for some patients, but this is a good general way to remember what amount of vitamin D most patients need. And in terms of how patients should get their vitamin D, it's sometimes referred to as the sunshine vitamin because our bodies make vitamin D in response to exposure to sunlight. But don't recommend sun exposure without sunscreen as a way to increase vitamin D levels, due to concerns of skin cancer risk from sun exposure in general. Instead, we can help clarify how patients can get vitamin D from food and supplements if needed. So first, we want to think about how much vitamin D patients may be getting from foods. Unfortunately, There aren't too many foods that have high vitamin D levels, but we can educate patients about food sources. Fatty fish and egg yolks are the best natural food sources of vitamin D, but other foods may be fortified with vitamin D. For example, there's about 1 microgram or 40 international units of vitamin D in an egg yolk, 2 to 3 micrograms in a cup of fortified orange juice or milk, and 12 micrograms in 3 ounces of salmon. These are just examples, and we can check labels for specifics, since the amounts vary for some fortified products. But the amount of vitamin D a patient gets through food really depends on their diet. Now, you may have noticed that there have been changes over the years in how food or supplement labels list the amount of vitamin D on their ingredient panel or labels. I think many of us may be used to seeing vitamin D listed in international units, or IU. But a rule a few years ago requires vitamin D amounts to be listed in metric units. So, just as a quick refresher, you can quickly convert vitamin D from the old international units to the newer unit of micrograms by dividing by 40. 1 microgram equals 40 international units of vitamin D. For example, 400 international units of vitamin D equals 10 micrograms. 1,000 international units of vitamin D is 25 micrograms. So I think you can see that we play a huge role as pharmacists and technicians to stay alert for errors and to help convert doses if needed. The updated labels will have to list doses in metric units, but some manufacturers choose to keep both units to limit confusion. So we can help sort through any confusing labeling. But regardless, not all adults need a vitamin D supplement. Despite fortified foods, 41% of the U.S. population is deficient in vitamin D. This could be due to multiple factors, including deficiency in the diet and lack of sun exposure, among other reasons. And because of this, the Endocrine Society now recommends empiric supplementation in certain groups of patients. What this means is that these patients need more than the usual recommended daily amount of vitamin D, regardless of their vitamin D level. Patients will usually need to get this added amount from vitamin D pills or drops, like a prenatal vitamin or foods. And either type of vitamin D is appropriate for supplementation. Vitamin D3, which is cholecalciferol, or vitamin D2, which is ergocalciferol. So let's take a look at the 4 groups of patients that the Endocrine Society recommends empiric vitamin D for. Empiric vitamin D supplementation is now recommended for 4 key groups of patients: children and adolescents 1 to 18 years of age, patients 75 years and up, patients who are pregnant, and patients who have prediabetes. And over the next few slides, we'll elaborate on why vitamin D is recommended for these patients and some nuances to be aware of. So, starting with children, guidelines recommend these patients get vitamin D supplements to prevent nutritional rickets and because of the potential to lower the risk of respiratory tract infections. The guideline does not provide a dosage recommendation for this group, and dosages in the trials range from 300 to 2,000 international units daily. They do provide the average weighted dosages for the respiratory tract infection outcomes, which were about 1,200 international units to 1,500 international units per day. This is much higher than what is typically found in children's multivitamins, which is typically 400 to 600 international units. Continue to recommend that kids get a multivitamin and encourage parents or caregivers to talk to their child's pediatrician to determine whether higher amounts of vitamin D are needed. Screening is not recommended in this population unless, again, there may be an underlying cause for malabsorption. For people 75 years of age and older, routine testing of vitamin D levels is not recommended. However, empiric vitamin D supplementation is recommended because of its potential to lower mortality. But the mortality effect was small. Taking about 900 international units, or 22.5 micrograms of vitamin D daily for 2 years, led to 6 fewer deaths per 1,000 people. And an evidence review showed no conclusive evidence that supplementation lowered risk for fractures, falls, or infections in this age group. Be aware that the vitamin D dosage ranged from 400 to over 3,000 international units daily in clinical trials included in the guidelines systematic review. So specific dosing recommendations remain unclear and varied greatly. But the guidelines indirectly suggest that supplementation with about 1,000 international units daily is reasonable. Help patients weigh pros and cons of taking vitamin D. For example, consider pill burden or cost. And if these older patients want to take vitamin D, stick with lower daily dosing, such as 800 to 1,000 international units daily in place of higher weekly dosing. Moving on to our next group, the Endocrine Society also recommends vitamin D supplementation for pregnant patients with the goal of reducing preeclampsia, intrauterine or neonatal mortality, and preterm birth. But doses and trials varied widely, but most supplemented with at least 400 international units of vitamin D, but also up to 2,000 international units. Plus, the new recommendations for pregnant patients are based on studies with results that may be due to chance, and most were conducted in countries where the standard of care differs from the U.S. So for now, continue to follow the American College of Obstetricians and Gynecologists recommendations for all supplements during pregnancy, and continue to recommend a typical prenatal vitamin, which usually contains vitamin D. Finally, the fourth group of patients that new guidelines recommend empiric vitamin D for is those with prediabetes. And the reason behind these patients taking more vitamin D is that it has the potential to lower the risk of progression to diabetes. But in patients with prediabetes, pooled data show that the jury's still out over whether taking vitamin D reduces the risk of developing diabetes or lowers A1C. Plus, this is with higher doses, about 3,500 international units daily. For these patients, continue to emphasize lifestyle changes with proven outcomes, such as a healthy diet and regular exercise, instead of vitamin D supplementation. Again, routine screening is unnecessary unless there are signs of vitamin D deficiency or an established indication. Empiric supplementation is not recommended for most healthy adults under age 75. If your patient wants to take vitamin D, here are some practice pearls to prevent errors or harm. Keep patients' profiles current with ages and medical conditions. Find out why patients are currently taking vitamin D if they already are. Watch for mix-ups among vitamin D forms. Recommend lower daily doses over larger intermittent doses. Make sure patients understand the frequency of dosing, whether it's daily, weekly, or monthly, and be alert for dosing errors with vitamin D prescriptions. See our resource, Calcium and Vitamin D, for more detailed information and recommendations on vitamin D.
We hope you enjoyed and gained practical insights from listening to this presentation. Be sure to follow or subscribe, rate, and review this show on your favorite podcast app. Or find the show on YouTube by searching for TRC Healthcare or clicking the link in the show notes. While you're there, check out our other TRC podcasts like Medication Talk and Rumor vs. Truth. Also in the show notes, we've linked directly to a few of the excellent resources mentioned today, available to subscribers of Pharmacist Letter, Pharmacy Technician's Letter, or Prescriber Insights. On those websites, you'll also find a lot more evidence-based, concise, yet comprehensive resources on this and other medication therapy topics. If you aren't already a subscriber, don't miss out on these resources. Sign up today to stay ahead with trusted insights and tools. We are an industry-leading, non-biased source of information and continuing education. And if you're a student, good news. Students can access a free version of Pharmacist Letter. We've linked to that directly in the show notes as well. Check it out. Find out more about all of our product offerings at trchealthcare.com. You can also reach out to provide feedback or make suggestions by emailing us at contactus@trchealthcare.com. Thanks for listening to Clinical Capsules.